Everyone, welcome back to Nursing Simplified. In today's lecture, we will discuss epistaxis, a medical surgical condition which is also known as nosebleed. It is a common ENT emergency that can occur due to local causes within the nose or systemic conditions affecting the body. Understanding the causes, clinical manifestations, management, and nursing care of epistaxis is important for nurses to provide prompt and effective care. Definition: Epistaxis means bleeding from the nose. So, bleeding from the nose due to rupture of the blood vessels in the nasal mucosa. The blood vessels present in the nasal mucosa will be ruptured, and which causes bleeding from the nose. It is common in children and adults, and the bleeding can be from one nostril or both the nostrils and can range from mild bleeding to severe hemorrhage. Anatomy of nose. So, nose has rich blood supply. Kieselbach's plexus. It is an anastomotic arterial network of 4 or 5 arteries in the nose, supplying the nasal septum. Lies in the anterior inferior part of the septum. So, Kieselbach's plexus is also known as Kieselbach's triangle or little area. The next, Woodruff's plexus. So, it is a dense network of thin walled blood vessels located in the posterior lateral wall of the inferior meatus of the nasal cavity. So, anterior bleeds are more common when compared to that of posterior bleeds, but the posterior bleeding is more severe and dangerous, which needs medical care immediately. Causes: the causes can be local causes or systemic causes. The local causes include trauma or injury to the nose by picking, by or through infections, foreign bodies, deviated nasal septums, nasal tumors, and everything can be the local causes. Systemic causes include hypertension, bleeding disorders, allergies, liver disease, and anticoagulant therapy. So, it can be the systemic causes for this epistaxis. Risk factors: hypertension, the patients suffering having hypertension, and the persons who are using blood thinners, who use blood thinners generally, those who have blood clotting factors, for those who have thrombus or embolism like diseases or recurrent blood clotting. So those people use blood thinners. And recurrent nosebleeds, recurrently if the person is suffering from bleeding and bleeding from the nostrils, dizziness, weakness, all these are risk factors and the symptoms. Types of epistaxis: anterior epistaxis, posterior epistaxis. There are two types of epistaxis. Anterior epistaxis originates from the front part of the nasal septum, usually from the Kieselbach's plexus. It's a most common type, and it is easier to control when compared to that of posterior epistaxis. Posterior epistaxis arises from deeper blood vessels in the posterior nasal cavity. It is usually more severe and commonly occurs in elderly patients, and it needs medical care. This is the diagram of epistaxis or Nosebleed. So these are the Kesselbach's plexus. They are present in the anterior front part, and Woodruff's plexus. They are present at the back or the posterior part, and it is common in children and of course in adults. Signs and symptoms or clinical manifestations of epistaxis. So visible bleeding from the nose. Bleeding is visible, bleeding from the nose, sometimes from one nostril and sometimes from both the nostrils. There can be swelling, bruising of the nasal mucosa, blood trickling into the throat, dizziness, weakness, anxiety, difficulty breathing in severe cases, and in sometimes in severe cases there will be signs of shock due to blood loss. Diagnostic evaluation. So we take a detailed health history and assessment of bleeding episodes when the person is experiencing this bleeding at, and the duration of the bleeding and the episodes of the bleeding, we take the detailed health history if they have any family histories of this bleeding, and we conduct a physical examination. Most probably they use nasal speculum to observe the nasal cavity. And complete blood count can be done to assess the loss of blood, and if there is any anemia for the person, if there is excessive blood loss that leads to anemia, to know that, do the complete blood count. And also bleeding time and clotting time tests can be done to know the duration of the bleeding and clotting time, so how much time it is taking for the blood to clot, to identify if if there are any clotting factors, insufficiencies, or any disorders of the coagulation disorders. Nasal endoscopy can be done to identify the from where the bleeding has been occurred, from where it occurs, and how it can be treated. X-ray or CT scan of nose can be done to know if there is any trauma, any hemorrhage, any clots, and to know if there is any infections present in the sinuses, tumors. And biopsy can be taken if there is any malignancy suspected, that means any cancerous cells or any nasal mass present in the nasal cavity in that region. So, biopsy can be taken and sent to the laboratory to view the cell mass. Complications can be anemia if there is a continuous or recurrent or severe blood loss due to uh, epistaxis infections, which can progress into the upper respiratory tract and leading to the lower respiratory tract. Airway obstruction due to accumulation or trickling of the blood into the throat or into the airway tract. Shock in severe and rare severe cases due to excessive loss of blood, but of course it is rare. Medical management to stop this bleeding, medical management, um, pinch the nose for some time so that the blood vessels can be compressed, which can lead to the pause or stop of bleeding. Cold compress can be given. Nasal decongestants like oxymetazoline can be given to the patient. And cauterization can be done. It is a minor procedure used to stop persistent or recurrent nosebleeds, where the broken blood vessels are sealed in this cauterization process. Nasal packing or surgery can also be done. Nasal packing is it's also a medical procedure used to stop the nosebleeds, which do not resolve through um, direct pressure, topical vasoconstrictors, or cauterization process. So the bleeding which is not stopped through even through cauterization process, the nasal packing can be done to stop the bleeding, and even sometimes surgery. So repairing of the blood vessels or anastomosis can be done in severe cases. Nursing management, maintaining the airway of the patient and monitor the vital signs, educate the or nasal care, taking how to take the nasal care to the patient, and the nurse should assess the amount of bleeding, reassure the patient, maintain airway patency, assist with nasal packing, and observe for recurrent bleeding, prevent, educate the patient to prevent nose picking, excessive blowing of the nose, and maintain adequate nasal moisture. And first aid can be at the time of nasal bleeding. The immediate first aid that can be done is sitting in upright position and leaning forward so that blood will not be trickled into the throat or accumulated in the airway. Pinch the nose for 10 to 15 minutes to stop the bleeding, and breathe through mouth when the nose is pinched. Apply cold compress and seek help or medical care if the bleeding exceeds more than 20 minutes. Prevention. Preventive measures include controlling hypertension, treating nasal infections, avoiding trauma, and maintaining humidification of nasal passages, avoiding picking injuries. All these are preventable measures. So, epistaxis is a common ENT emergency that requires prompt assessment and management. Understanding its causes, clinical manifestations, treatment, and nursing care helps nurses provide effective patient care and prevent complications. In today's lecture, we have discussed about the topic epistaxis. I hope this lecture helped you understand the topic clearly in a simplified manner. If you found this video useful, do not forget to like, share, and subscribe to the Nursing Simplified for more nursing lectures. Thank you for watching. We'll meet again in the next lecture.